that's a factor as well.
Sure. Tell us what topics do you teach in medical school? What lectures do you give? What
Yeah,
topic?
great. So I'm in the radiology department. So we teach. I'm not in the nutrition departments, but as a radiologist, one of the things about this specialty is we have to look at the coronary arteries on the scans, and we can literally see the plaques, we can see the calcification, we can see the narrowing. On the Alzheimer's disease patients, we can look at the PET scans. We see the glucose utilization diminished in Alzheimer's patients, and in the cancer patients, we literally. So I'm in the radiology department. So we teach, I'm not in the nutrition departments, but as a radiologist, one of the things about this specialty is we have to look at the coronary arteries on the scans, and we can literally see the plaques, we can see the calcification, we can see the narrowing. On the Alzheimer's disease patients, we can look at the PET scans. We see the glucose utilization diminished in Alzheimer's patients, and in the cancer patients, we literally look at all the tumors. So although I'm not primarily involved in teaching nutrition, the things I teach in the cancer patients, we literally look at all the tumors. So although I'm not, the glucose utilization diminished in Alzheimer's, we teach, I'm not in the nutrition departments, but as a radiologist, one of the things about this specialty is we have to look at the coronary arteries on the scans, and we can literally see the plaques, we can see the calcification, we can see the narrowing. On the Alzheimer's disease patients, we can look at the PET scans. We see the glucose utilization diminished in Alzheimer's patients, and in the cancer patients, we literally look at all the tumors. So although I'm not primarily involved in teaching nutrition, the things I teach describe nutrition and the drivers of it. I mean, diabetes, we're all affected by diabetes. The number one cause of amputation, number one cause of blindness, number one cause of renal failure. We see it throughout the day. So my main teaching is to residents and house staff and doctors, but I also teach medical students as well. And one thing, we've just started a new residency program in California here at a hospital that we've started family medicine, we've started psychiatry, transitional year, and hopefully in the spring, we're going to start radiology. And this is an ACGME, American College of Graduate Medical Education accredited residency, where we're going to be teaching residents with this new philosophy about health, metabolism, diet, and hopefully we'll repeat fewer of the lies that are still being repeated today.
Yes, definitely. I can remember I, unlike most doctors, I actually had a class in nutrition. My second year of medical school, I think it was every Tuesday for an hour, we had a lecture, and I'll never forget the professor of nutrition. He was a PhD lecturer, and he had type 2 diabetes, which he controlled with insulin. And he was from New Zealand. And I remember very clearly that he recommended very highly that we recommend to our patients that they eat whole wheat pasta. That's how he said it. And I'm a redneck from Tennessee, and I'm like, pasta? Who said that? But so he also talked about how he had to be very judicious with his insulin dose because he would get hypoglycemia if he over-injected. And so but he was a huge fan of whole wheat pasta. And so this is the guy that was literally teaching the doctors. He had type 2 diabetes, and he, being a nutrition professor, he had the complete globe of knowledge that he could have reversed his type 2 diabetes, but he didn't. He ate whole wheat pasta and injected insulin every single day. And I'm sure he's passed on now. God rest his soul. But that was the extent of my nutrition instruction with regards to how you would manage a type 2 diabetic, is to give them lots of whole wheat pasta and lots of insulin injections and watch out for hypoglycemia. Now, fun fact for you, Dr. Lufkin, I was a radiologic technologist before I went to med school. And I went with the full intention of either being a surgeon or being a radiologist. And radiology got ticked off because very early I had to mark that off, because here in Tennessee, we have something called TennCare. And when I was going to medical school, radiology was a very comfortable specialty, very comfortable, right? Very nice. You just sit in a room and dictated, and people brought you stuff, and it was nice. Then all of a sudden, TennCare popped up, and radiologists were getting $5 to read a chest X-ray. And, I'm like, no, never mind. Plus, I really wanted to be a surgeon. So, but radiologists now in Tennessee, it's no longer a comfortable specialty. It's not, it's nothing to brag about. So, but I remember very clearly my radiology lectures. I took an elective my 4th year of med school in radiology because I was still kind of considering that. And I loved the instruction because I was very interested in that and I was very good at it. And I remember the first class, the instructor, who was a radiologist, threw up a chest X-ray, a PA, and he said, "Now you can see that this person has a pneumothorax, a collapsed lung." And I was in the back of the room. I was a back of the room kind of student. But I had been looking at X-rays for years as an X-ray tech, right? And so he talked about the pneumothorax and how we had to this and that. And I kept looking at the X-ray, waiting for him to finish the sentence. And he didn't. And so I thought, well, I'm going to show how smart I am. I raised my hand from the back of the room and I said, it could be that the 3 rib fractures there are what caused the pneumothorax. And immediately I knew I'd stepped in it because all the students were like, "Rib fractures? What's he talking about?" And then obviously the radiologist did not either had not seen them or it was just a teaching case. I don't know. But the radiologist was not happy that I had pointed out the 3 rib fractures that were, as you know, as a radiologist, they can be very challenging to see. But after looking at them for years, they just jumped out at me. I'm like, well, duh, there's 3 rib fractures. He probably has a flail chest. And that did not go over well. And so that was one of the very first times that I learned that in medicine, often the best strategy is to shut up, never ask why, just write down what they tell you and then regurgitate that on the test. And so you're saying with this new residency program, you're going to maybe even encourage medical students and residents to ask why.
Hopefully, yeah. I mean, one of the best quotes and sort of the inspiration for my book, but one of the greatest doctors who ever lived was Sir William Osler, and he has one of the best quotes about medical education that he gave to a class of graduating medical students who were on their way to the day they became doctors, and he said, and he was from the late 1800s, but his quote was, "Gentlemen." And of course, at the time, they were all gentlemen, or they were all male, if not gentlemen.
Right. Said, perhaps not gentlemen, but male. Yeah.
He said, "Gentlemen, we have a confession to make. 50% of what we've just taught you is incorrect. And furthermore, we don't know which half." And that was true then. It's true now. That's the nature of science, nature of medicine. We all have to be humble. We all have to keep looking at things, just like you're doing, like I'm doing. We all need to be open-minded, and I've said, if the Coca-Cola company, if it comes out with a controlled trial that Coca-Cola is a healthy drink that will make me live longer, I will go back to drinking Coca-Cola every day. I will follow. I just want to follow the science. I want to do wherever the science takes me.
Yeah, and I totally agree. And I've said that many times. Obviously, I'm capable of changing my mind because I've already done that and apologized publicly for my past indiscretion. What is your, and so, yes, absolutely. If there was well done research, and definitely I would check the funding of the research, right? I would not want to know who funded that. But if it came out like it's blatantly obvious, drinking Coca-Cola will improve your health. And there's just no arguing that. Like, here it is. This is it. I would change my tune. I would apologize again and say, well, I guess you should be drinking Coke because this study is very clear. But I think most doctors do not have that. And I want you to talk about this. I can remember the things I was taught in med school. Nobody in med school ever said to me, "Now, you do not change your mind. No matter what evidence comes out, no matter what paradigms change, you stick to the story." No professor ever told me that. So why, Dr. Lufkin, in the first few years of my medical practice, why was I so emphatic? Why was I so militant you need to just join the gym and join Weight Watchers if you're overweight. If you're type 2 diabetic, then you just need to, eat lots of complex carbs. Why was I so hard-headed as a young doctor? Nobody said, here's a check for 100 grand. But you got to stick to the party line. Why is the average doctor so militant? And why do they become emotional so quickly when a patient pushes back?
Yeah, that's a great question. I think you're right. Nobody really said it to us, but I think there's an unspoken message that as physicians and other healthcare providers, we need to maintain the orthodoxy. In other words, there's so much noise coming in, snake oil, and so many unfounded things that as physicians we need to be conservative, and we have to be very careful about changing our opinion. So I remember I was militant about taking those egg yolks out. I don't want to clog my arteries. Eat a red steak, eat red meat. No, I don't want to do that. But yeah, so I think it wasn't spoken, but it's something that we're taught non-verbally or indirectly, and that's the bias we have. And I have to say, I think I don't. I basically I love my vegan friends. I love my carnivore friends. I think you can be healthy anywhere on the spectrum. I think it's much more. What you want to avoid is junk food, and I think it's much more challenging as a vegan because of the potential deficiencies. And I used to be a vegan. There's so much junk food available. I was a junk food vegan. I think it's easier on the carnivore side, especially your proper human diet. Going that way just makes it simpler. You get your nutrient dense foods, but out of respect for everyone's taste, I think it's possible to be healthy with any of those diets, but some are just harder work than others.
Yes, I totally agree. Now, this is being recorded live in front of our private tribe in our community. And so if you don't mind, Doctor, if they have questions, I'm going to pop a question up on the screen. If you guys are watching this on the replay on YouTube, the way to get to ask experts like Dr. Lufkin questions is to join our private community. There's a link in the show notes. We've got a question here from Allison. What are the continuing education requirements for physicians? For example, is it specialty based? So if you're a surgeon, you have to keep up with surgical literature. You want to take that first, Doc?
Sure. Yeah. I can speak to radiology. We have to maintain our licenses